Hey guys, what's going on? Welcome to another video on my channel Hairliciously. It's actually been quite a while since I've last talked about microneedling for promoting hair growth, and I wanted to sort of go in depth in detail on some of the things that you guys can do that you may not be aware of in order to maximize hair growth potential by incorporating microneedling into your hair loss treatment regimen. As we all know, microneedling therapies have just kind of really exploded in popularity over the past few years. And there's also been a growing number of research that shows the benefits of microneedling in stimulating hair growth. The mechanism of action for microneedling involves wounding the balding areas to evoke activation of dermopapilla-associated stem cells and also growth factors. And over time, these growth factors help in promoting the formation of new blood vessels, reducing the appearance of scar tissue, and it also helps in the revascularization and promotion of hair follicle proliferation. We also know that microneedling at certain needle lengths helps with the increased thermal absorption of topicals for better efficacy. And later in this video, I will be going over this more in detail. Now, most of you guys are probably familiar with one of the most popular microneedling studies by Dr. Durat, where they compared the efficacy of weekly microneedling at 1.5 millimeter plus twice daily minoxidil 5% versus just the minoxidil monotherapy group. And after just 3 months of treatment, the microneedling with the minoxidil twice a day group had achieved over 400% more hair regrowth compared to just the minoxidil monotherapy group. There's another study that compared the minoxidil along with 1.5 to 2.5 millimeters automated microneedling, and over the span of 6 months, they found comparable hair count increases similar to that of Dr. Durat's study. And something to kind of note about most microneedling studies is that they generally skip minoxidil application on the day of microneedling, and they usually wait about 24 hours for the next minoxidil application. And this is, obviously to reduce any potential side effects from the topical going systemic into the bloodstream. Although some people actually do report that they've, applied minoxidil right after microneedling. They didn't experience any adverse side effects, and this is something that I wanted to talk about a little bit more in detail. But all in all, there's a bunch of clinically tested studies on microneedling and its benefits in promoting hair growth. So it's no secret that there is growing evidence that microneedling works. And for those who are not utilizing this mechanism of action, should really consider adding it to the hair loss treatment stack, especially if you're not really seeing any gains from just topical minoxidil alone. So the typical conventional treatment with minoxidil and microneedling involves using minoxidil twice a day and microneedling once a week around 1.5 millimeters. And this has kind of been the common protocol for a lot of people who have incorporated both treatments. Others have also used the retinoid tretinoin at various concentrations in conjunction with topical minoxidil to increase the amount of sulfotransferase enzyme present in the hair follicles, which is required to transform minoxidil into its active metabolite, minoxidil sulfate. Now, one caveat to this is that oral minoxidil's efficacy is typically going to be far more superior than topical minoxidil because people's scalp levels of the sulfotransferase enzyme required to convert minoxidil into minoxidil sulfate is going to vary considerably, and those that generally get better results topically tend to have higher levels of this enzyme. Oral minoxidil, on the other hand, will be fully absorbed into the bloodstream and metabolized in the liver into minoxidil sulfate. So there's a lot of minoxidil users who achieve really good hair growth compared to topical users. Obviously, there are going to be higher side effects when you generally ingest medication as opposed to topical application. So if you have issues with high blood pressure, water retention, or heart problems, it's probably best that you speak with a doctor prior to using oral minoxidil. I will say though that if you are using oral minoxidil, it really doesn't make sense to use microneedling at lower needle lengths for absorption purposes for minoxidil because it's already being ingested orally, and the only benefit you'd really get at using a lower needle length is for absorption of other topicals such as topical finasteride or dutasteride or other anti-androgens. And unless you're using both topical and oral minoxidil, it still wouldn't make sense because oral minoxidil's efficacy outweighs that of topical minoxidil and their mechanisms of action are the same. But I do still recommend you microneedle once a week at a higher needle length, such as 1.5 millimeters, so that you can still reap the benefits of wounding for activation of stem cells and growth factors. Now, with that said, there are people who actually have reported better results and improvement in terms of hair regrowth from microneedling more frequently, and also at various needle lengths instead of just the conventional weekly microneedling at 1.5 millimeters. And this also takes us into the importance of the specific needle length application. The smaller the needle length, the quicker your healing is going to be, and the more frequently that you guys can microneedle. And on the other hand, the larger the needle length, the slower the healing is going to be, which means that you need to kind of cut down on the frequency. And this is very important, and a lot of people kind of forget about this because the depths at which these needles puncture our scalps has a direct influence over which regions of the hair follicles that is going to stimulate. So from my research, there's been a growing number of people who were using a shorter needle depth of around 0.25 to 5 or 0.5 millimeters on a daily basis for improving the absorption of topicals. At this needle depth, this would only wound the epidermis, and it's not going to evoke the growth factors necessary to encourage hair follicle proliferation. However, once you get to a longer needle depth of 1.5 millimeters or higher, this would puncture the dermis of the scalp skin, and this has important ramifications to hair follicle proliferation because the dermis is where the hair follicle stem cell bulge resides. And by stimulating the stem cell bulge with microneedling, the growth factors stimulated during wounding can signal to these hair follicles to initiate a new anagen phase of the hair cycle. So to put this all together, one of the microneedling protocols that have seemed to kind of anecdotally work well for some users is to first microneedle at 0.5 millimeters on a daily basis prior to minoxidil application. Obviously, if you have side effects from applying minoxidil right after microneedling, you shouldn't do this, and you should just kind of stick with your 1.5 millimeter microneedling once a week and then wait 24 hours before applying minoxidil. But if you are like some users who have no adverse side effects from applying minoxidil right after or other topicals right after microneedling, this may actually help increase the absorption of the topical and thus lead to potential better regrowth due to the better absorption of the topicals on the scalp. Combination treatment would be to microneedle at 0.25 or 0.5 millimeters daily, apply tretinoin, and then apply minoxidil a few minutes later. You can also try this on a daily basis, and on the 7th day, transition to the 1.5 millimeter microneedling to stimulate the growth factors via wounding. Unfortunately, this method hasn't been conducted in any clinical testing, and it'd really be interesting to see how the efficacy would compare. But it seems to have worked in some users anecdotally for better hair regrowth, and maybe an alternative solution for those who may want to maximize their hair regrowth potential by increasing the absorption rate of minoxidil and other topicals that are being used. As far as microneedling tool preference, I like using the Dr. Pen because it's motorized. There's no pressure variability when it comes to wounding. But dermal stamp or a dermal roller would also work as long as you're able to provide consistent pressure during application. The main thing is that you're trying to achieve pinpoint bleeding or at a minimum of erythema. And in a separate video, I will try to do a demonstration on how to combine all these treatments. I personally don't apply minoxidil right after microneedling because I tend to have side effects. Everyone reacts differently. Some people don't really have any adverse side effects, and they're able to microneedle and apply minoxidil right after for better absorption and have seen some superb results. But that wraps up this video, guys. Hopefully this has been educational and helpful. Hopefully some of you guys can try this out and maybe even get better results. And for those who are non-responders to the traditional once a week microneedling at 1.5, perhaps you can throw in daily microneedling at a lower needle length for enhanced topical absorption of minoxidil and see better results and improvement. Let me know in the comments if you've tried this protocol and if it's worked out for you. If you have any other solutions that may work in improving hair regrowth, please do share. As always, thanks for all of your support. And also, if you need any microneedling devices, you can visit my website at hairliciously.com for some recommendations. But thanks again, guys, and I will talk to you guys in my next video. Take care.